Hey you guys, it's your girl Catherine Danielle and I'm back again with another video. If you are new here, welcome, and if you're not new here, then welcome back. So in today's video, I'm going to be discussing how I passed NCLEX on my first try. So if you're interested, stick around. Okay, so for me, I'm gonna first start by saying I did not start studying right away. I think if you watched my video about, what video was that? I think it probably was I passed my NCLEX or passing HESI. It probably was one of those videos. But I definitely took some time from nursing school. Like nursing school is so strenuous. Like, oh my gosh, like you can't work, you can't do things that you normally do. Like, it is very demanding. So for me, it was just like, listen, I am done with nursing school. I wanted a break. I wanted to detox. Like, I did not want to study. I didn't want to do anything or touch anything nursing related unless it was like a show. So I definitely took some time off, but like I was studying here and there, rarely. I was watching like Mark Klimick. I'm not sure if that's how you pronounce his name. I was watching like a little bit of his videos. I was using like nursing.com a little bit, like, you know, reading things here and there. I didn't really start studying like seriously until literally the week of me taking NCLEX, y'all. Like, I was just like, no. And going back, I definitely won't do that again. And speaking to other nursing students who are out there, I definitely wouldn't recommend that. For me, just by like through nursing school, when I cram, like it kind of works for me. Like, I know everyone is different. So for me, even though I studied in that week, you know, I knew enough to pass, you know, because basically NCLEX is like testing you at entry level just to see if you're competent enough to take care of a patient. And even with me, you know, studying just that week, like seriously, you know, I still passed. So like what works for me definitely you know, may not work for somebody else, which is why I'm advising that you definitely want to take studying seriously, and especially if like you haven't worked in healthcare at all, like you're not familiar with drugs, you know, certain procedures. I would definitely recommend that you definitely take studying seriously. I would recommend that you study like some questions like 3 days out of the week, and like maybe like the other 2 you probably just watch like refresher videos, or maybe you may read up on like a topic that you may have gotten wrong. But you definitely want to take studying seriously, you guys. Don't slack off. I know nursing school is very like strenuous. I've been there, I understand, but you definitely don't want to fail. You don't want to go back having to pay fees again. Like, you just want to pass it on your first try. And if you didn't pass it on your first try, that is okay as well. What I always recommend people is, if something didn't work the first time, you have to go back to the drawing board and you have to try something else. If you're doing the same thing, you're going to get the same results. There's something that you have to do differently. So for me, what I used to study was Archer review. I'm not sure if anyone has heard of Archer, and I chose that particularly because I felt like it was affordable for what I was getting. However, I just brought the test bank. I didn't buy like the combo that comes with the videos and all of that. I just brought the test bank and I used my Saunders book. I think I have the blue edition. I'm not sure exactly. I'll insert a picture somewhere here. And that is literally I used that book, but I also used like the Saunders. Like, I answered questions online. So what I would do is I would answer, like, Archer has like practice exams, and then they have like exams that's like sort of like the NCLEX, like it's timed. So I would do both of those. And like I said before, like I was not really studying, so I was kind of getting like borderline for passing. And then like when I started actively, you know, really studying, I started getting high, and then my last exam was very high, and I was like, okay, that at that point, like, I'm just going to stop taking practice tests because my test date was coming up. So like I would answer, like I would do a test, And for me, I definitely go back into the rationales, and like I read what I got wrong, you know, on the topic, but then I also focus on if it's like psychosocial, if it's physiological, if it was like pharmacology. Like I look at the topics, like the subtopics or the concepts, and then I would see like which ones I was getting incorrect, or if it was maternal, if it was cardio, if it was med surge. And then I would go to my Saunders book, and I would like review those topics that I probably didn't remember from like the beginning of nursing school. And then like I would go onto the Saunders on I would go on to Evolve, and I would answer like questions, because on Evolve, with Saunders, you can go to like pharmacology, you can go to psychosocial, you could go like to individual topics, and you can answer questions on those to refresh yourself of like what these questions are kind of asking me, like what are you most likely to do, what are you most likely not to do. I apologize if you guys hear the train in the background, because I'm kind of filming this late. But yeah, so I would kind of do that so I could familiarize myself with what the questions were asking for, like to pay attention to keywords like not, most likely, first, initial, you know. So I would kind of pay attention to those, and that would help me answer questions. So after that, I definitely was practicing questions. I was reading. I won't recommend reading the whole Saunders book from beginning to end, because that is so much content to read. Like that is, I was just primarily focusing on things that I didn't remember, or like things I probably needed a refresher on. Like when it came to the psych medication, I knew that this had to be in like you know, the serotonin uptaker inhibitors. I knew this one had to be in the reuptake. I knew that this one was the MAOIs. Like I had to separate, you know, which one fit into which category. And then, you know, depending on what side effects they have, you know, certain medication have like antidotes. So then like I had to, you know, just refresh myself on things like that. So I did that. I was answering questions like non-stop. I think I was probably answering like 2 to 3 questions in a day. I definitely won't recommend like studying or try to study for like 18 hours, 20 hours. Like that's too much. You definitely want to take breaks in between, but don't let your breaks be too long. You definitely want to time yourself. You want to keep yourself grounded and disciplined. And in the beginning, I think I changed my date. I originally changed my date because I always knew I wanted it in February, but only January was available. So that one I won't count it, but I think I changed my date literally one time after that. And I was like, I was going to change it again because I was like, oh my god, all the kids I went to school with are testing and they're passing. I'm scared that I'm not going to pass it because I haven't really been studying. But I was just like, hey, we're going to keep this date. We're going to study and we're going to execute and do what we have to do. So yeah, like, you know, I studied and I went in and I had the max amount of questions. Like, I did not stop at 75. So I know some people be like, if you get max questions you didn't pass. Like literally it could go either way, you know what I mean? Don't let that determine if you passed or failed, if you get max amount of questions, if you pass 75, because I'm a living testimony, or I'm a living example of getting the max amount of questions and I passed. And it's like, I'm not really surprised by that because like I said, you know, I started really studying, like really studying the week of my test. So it's like, that's kind of not surprising to me. I know if I definitely took it more seriously, that I probably could have stopped after 75 questions. But you know, it is what it is. Like I already knew that was one of the consequences, but at the end of the day I knew that I studied enough that I knew I was gonna pass based off of the practice questions I was taking on Archer. So then, you know, I went in, I did my exam, and I literally didn't do anything for the rest of that day. If you watched my vlog where I was like pass or fail, I took my NCLEX, I will leave that up here somewhere. I didn't do anything that day, and like the following morning I got my test results. No, I take that back. The same day I did like the Pearson VUE trick that everyone is talking about, and I got like the good pop-up. So I was just like, yes. But I was just like, I don't know if this is for real or not. So I waited until the next day and I got my results and it said passed. So like I was just so happy, y'all. Like I was just like, yes. Like I've been wanting to become an RN for a long time, because like I was LPN for a long time and I wasted so much time, and it was just like I had to really redirect my focus and really tell myself like we need to get the ball rolling. So like I'm glad, like, you know, I finished it. I passed on my first try. Like, you know, and I thank God for that. For anyone who has failed you know, their NCLEX the first time, whatever resource that you use, I would definitely say give Archer a try, because I just feel like it's just so helpful, and like the format of the questions were similar, you know, to NCLEX. So I'll definitely say try them. They are affordable. And one tip I would give you guys is do not use too many resources to study for NCLEX. If you have like 3-4 resources that you're using, stop. Because like I said in the beginning, I was using Mark Clinic and I was using nursing.com, and then towards the end I told you guys I was using Archer, I was using Saunders. That would have been 4 resources I was using at the same time. And like everyone asks questions different. You might get confused depending on their rationales. So I would definitely say stick to at least 1 to 2 resources when studying for NCLEX. For me, like I said, I used Archer and Saunders, and for me that worked. You know, like don't use too many things. Don't be sitting there using NCLEX Yield, Princeton, UWorld, Saunders at the same time. Like I feel like that's just setting yourself up for failure. You definitely want to stick to 1 to 2 resources, and I would recommend getting like a study group if you're a person that, you know, needs that. I know some people can study by themselves, they're okay by themselves, but there are some people who need that extra help. And like definitely reach out to people. Don't sit there, even kids that you went to school with, if you don't know an answer, you don't understand a rationale, reach out to somebody. You know, you can even reach out to me. I never mind helping you guys. You know, I'm a bit more active on Instagram. You can always shoot me like a DM. You know, I don't mind to do that. If you guys want me to probably ask like practice questions on my stories, I can do that. You know, because I definitely want everyone to succeed. If you can do it on your first try, like, you know, that's what I would want for you. You know, that way you wouldn't have to pay like fees again and all of that. But even if you didn't pass on your first try, I'm here for you, you know, to help if you need, you know, advice or anything to do things differently. So that's pretty much like what I did. And like I wrote notes down. Like for me, I'm a type of person that likes to write in my book, and like my books are ebooks. Like they're on my computer, they're on my laptop, and you know, I need something physical as well. So like I was like writing notes down on things like I wanted to remember. So then like when I seen like a maternal question, I knew like G was gravity, P was parity, T was termed, you know, like A was abortion. Like I had to make sure like I just kept like those simple, you know, like things like to remember. So that's pretty much like all I did. It was not anything crazy or too special. Like, you know, just to do a recap, I definitely took a break after nursing school, grounded myself, asked questions here and there, answered questions here and there. You know, I started studying. I stuck to 1 to 2 resources. I definitely refreshed myself on anything that I needed to read, any videos that I needed to see, maybe if I didn't understand by reading. And like I answered questions consistently. And you know, I paid attention to my rationales, because it's like I'm in some study groups and people are like, I'm not understanding why I'm getting this incorrect. And it's like when you're reading the rationale and when you're reading a question, they may give you 2 questions on a particular topic, but you have to pay attention to what the question is asking you. Is it asking you what's the first step, or is it asking you what should you do after this? Like you have to pay attention to that, because if you don't, you can get the question wrong. it can be something that very well happens after surgery, but there's different things that happen post-operatively within 24 hours, within 12 hours, and there's things that happen after 1 day, after 2 days. So it's like you have to pay attention to those type of things. So that's pretty much all the tips that I have. You know, if you guys have any further questions or like any other videos, you can definitely leave them down in the description box. I will be happy to answer any questions you may have. I hope you guys like this video. Please don't forget to like, comment, and subscribe, and I'll see you guys in my next video. Bye.